caregiver. Oftentimes, because there's a lack of planning and people are thrust in this position, the stress that comes with the caregiving has to do with some real specific things. First of all, what's the level of care that's needed? Many adult children that I work with are open and willing to help with virtually everything that mom might need until we get to a point where there are personal hygiene issues. And families really struggle with the responsibility for bathing or personal hygiene or toileting of an elderly parent, because we're just not built in a way to do that kind of hands-on care with someone who's a relative. The second thing that's a problem for a lot of folks is that the caregiving challenge is presented without an opportunity for them to choose what level of commitment or the timing that comes with being available to help mom and dad. Oftentimes adult children are facing health issues of their own, and so this now becomes an additional stress to them, which probably is going to have an impact on their physical and mental health. And one of the rules I set up for my adult children who are caregivers for aging parents is that it will be, do not get isolated, because as the elder caregiving role increases, the ability for me to maintain my own social life and time with my children and my spouse becomes more and more complicated. So a caregiver support system is a critical tool toward me succeeding and surviving as a caregiver for a senior member of my family. The stress takes lots of different shapes, and I would suggest that while a caregiver may be subject to any number of these stresses, I think that what happens is that we experience each one of these in different ways, shapes, and forms, and it can take a toll on our physical or emotional health. And oftentimes we see caregivers adapt behaviors that are a further negative impact on their health care and their functioning. Caregiving is a very expensive process based on the need for medication, medical supplies, durable medical equipment, therapy, long-term care, and so on. And oftentimes the financial commitment that comes with this is the real source of physical and emotional stress that families face while they're trying to do the right thing. MetLife has created a very interesting white paper that they did relevant to the research on the amount of time and money that it costs employers for employed caregivers. And so what I might suggest as we go through this slide is that you write a note to yourself that one of the best resources I have found is the research on the cost of caregiving that was done by the Mature Market Institute with MetLife. What you'll find on their website, metlife.com, is a very good list of research papers on the cost of caregiving, the impact of the workplace on caregiving, and so on and so forth, which sends a real message, I think, both to us as professionals and to employers that we need to find a way to help people embrace this very dominant role that presents itself on behalf of older adults. What happens in the workplace is that people tend to try and balance the things that need to be done around doctor's appointments and shopping and maintenance of the home with their responsibilities at the workplace. And the research is very clear that what tends to happen is people compromise work time to manage the elder care time, which also results in less time for families and family members and friends. And as my world shrinks, because my mom's needs have become greater and greater, I give up my hobbies and my social activities and vacation time, which creates complications for family members children and grandchildren. I don't have time for exercise, I don't eat well, and as you can imagine, those things then result in health, physical and mental problems, and lack of leisure, which creates overall lack of mental health for me as a caregiver. When we look at the physical symptoms of stress or the physical behaviors of stress which result in an inability to take care of ourselves because of a lack of sleep, which results in fatigue, there are a lot of physical things or medical disorders that present. A lot of adult children will tell me that they are anxious because they're not sure they can be a good caregiver, and that tends to translate into physical problems which result in headaches, colds, flu, and so on. And for many adult children who already have health problems, the physical stress that comes with caregiving tends to exacerbate all of those signs and symptoms of physical illness. I mentioned in a prior slide that this caregiving responsibility oftentimes happens unannounced, and many people become unwilling caregivers, which is a real source of emotional stress. The anger and the frustration that comes with a life that's compromised now because of a need for an older parent. A lot of caregivers have that feeling of helplessness because they've been presented with a role that they're ill-prepared to fulfill, and it actually has an impact on a lot of people's emotional balance and creates some emotional instabilities that add to the other challenges of taking care of a elder relative. Many adult children will call me in my practice and say, Jim, I don't even know which questions to ask. And so I think that oftentimes it's just helping people get started with understanding very clearly what the it of caregiving is and the skills that I have as a caregiver and how those match with the challenges that I'm about to face. Oftentimes what I tell folks is that the resources are there. We just need to be a little bit better about understanding what those are. I think as a certified senior advisor, one of the most valuable things that you can do for the people you're working with is to be a good resource when it comes to where those resources are in the community and how people can find them. And I'll talk about that a little bit more in detail in a later slide. I just want to add a footnote here. In the research that MetLife did on employed caregivers, they found that in a large study they did where they interviewed women who left the workforce early to be an elder caregiver, that the loss of salary and pension and Social Security was the equivalent of, on average, $274,000. So not only do we see a financial commitment that's made by out-of-pocket expense, but there's that unseen financial loss for potential pension and wages that I think contributes to this emotional stress as well. Oftentimes we find people who become caregivers who do not survive the caregiver process and in fact experience more serious physical problems than the person that they've intended to care for. There's a significant amount of substance abuse that occurs in people who are struggling to manage the challenges of elder caregiving. People will tell me I can take care of mom and make sure her personal hygiene needs are met, but by the time I'm done with that, I have trouble taking care of myself. Oftentimes, this elder caregiving pushes the responsibilities for home and kids and work to the back burner, and those tend to have short and long-term ramifications that create additional conflict in someone's life. And finally, this whole issue of isolation, as I mentioned before, is probably the key for me. I would suspect that elder caregivers would tell you that they've lost the ability to be in that book club and stay involved in church or have that time out date night with their spouse because the caregiving of a senior family member has become overwhelming. I often tell my families it's real important to offer the support to senior family members and to brothers and sisters who are doing caregiving, but be cautious about making financial commitments. The expense for things like medical equipment and medications can be significant, and typically those needs are very long-standing. So it not only becomes a big upfront expense, but typically one that has a chronic need that turns into weeks and months and years. I think in addition to doing the best that an individual can as a personal caregiver, the financial stress or the financial worries that come with that tend to be incredibly overwhelming. And with all of the discussion that we're hearing almost every day about the cost of health care in this country, I think people need to plan even more for having those resources available. A number of studies have been done, one in particular by the Veterans Administration, that found that the vast majority of people that they talk with were not aware of all of the resources that are available to people through Medicare, veterans benefits, and other kinds of medical insurance programs. So it's real important to have somebody who's available to help put those resources together or connect the dots, if you will, so people are aware of how to get the financial support that they need if they qualify. Most of the long-term care in this country is paid for with private money. Medicare is a very good insurance program that is designed to pay for acute care only, that meaning hospital care and a few days of nursing home care. And so finding a way to finance the long-term care needs for a senior, whether they're at home or in an institution, can be very daunting. I think people are better at planning now than they used to be, but one of the biggest myths around the area of long-term care and elder care is the nature of Medicare and what it covers. And when seniors tell me, I think I'll be okay because Medicare is going to pay for that, it's typically a misunderstanding on their part, and they're going to have a significantly larger financial liability than they thought they would have.